join me in welcoming Dr. Luanne Metz, MLA for Calgary Varsity and Chair of the Future of Healthcare. Dr. Metz has been a neurologist since 1988 and is internationally recognized for her contributions to neurology and medical research. She led the Division of Neurology in Calgary from 2014 to 2018, and she has dedicated her career to advancing care for patients with neurological conditions. Her leadership and expertise make her an invaluable advocate for improving healthcare in Alberta. Dr. Metz is here to kick us off on the first ever Neuropathy Awareness Day in Alberta.
Thank you very much, and thank you to all of the members and leaders in the Calgary Neuropathy Society for inviting me here today. But more than anything, congratulations for the work you've done over the last decades to get this society going and bring it forward so very far. It is. I also want to congratulate you for getting to the point now where you're getting government grants, where you're claiming a day to make neuropathy awareness something that's important in Alberta. At least in Alberta, things can spread because often you get a start in a society and others will follow the path. Sometimes it's eventually. Everything takes a really long time. Neuropathy is a critical problem. It's not rare, it's very common. I think that it probably took or takes a long time to pull it all together into a group or a society that can educate and lobby for the needs of people with neuropathy, longer than many things because it is such a bag of diseases and there are so many causes that contribute. So there might be a group that have one condition and they need to recognize that the better way to get the message out there is to join with others that have similar conditions, and it falls under this umbrella of peripheral neuropathy. I think that it's also really to be congratulated for knowing what it is that you're asking for at this point, and that is awareness. And I think that's really the next step as you go on and provide information to people that suffer from neuropathy and physicians, and making it more and more aware for physicians of neuropathy as an important condition, and to help them know where they can direct their patients for more information, knowing that you want to get as much support as possible to get the message out there to make this a Neuropathy Awareness Day. I don't have the power to grant that and make that an official government thing at this point, but I do recognize the importance of this from on many levels. And in my role in the NDP caucus, where I am chairing a committee called the Future of Healthcare, where we're looking at where we should be and what are the things that we need to get going on immediately when we form government, so that we can get started right away without delay, and understanding a path for groups like yours would be part of that. Of course, we have to put the pieces back together of our healthcare system, but knowing that there are many other critical things that have to happen, and we have to get building the pathway for groups like the Calgary Neuropathy Association. That is critical. So why am I here? Well, you've heard that I am a neurologist. I'm not practicing now. I did that for 35 years. And I've moved on into my second career, which is a much harder career, I'll tell you, which is as a politician, trying to move our province forward in many different ways, but healthcare is the thing that motivates me and pushes me, is to be able to have a voice and contribute to our team, many different areas of expertise on our team. And so it's really looking at what's happening in our healthcare system that pushes me. So that is my role here. But one of the things that you wouldn't know is that neuropathy is not only something that was a major problem for my patients throughout my career, and often a problem, especially with neuropathic pain, that I felt helpless. There's lots of medications out there, but none of them are any good. And we can try things that have a minimal benefit, but we really don't have great treatments for neuropathic pain. But the other thing is that my mother suffered from a hereditary neuropathy, not one with a name. Dr. Oksana Sikorsky, one of my colleagues who was also a medical geneticist, could see that this was a condition, but she had something very rare. And I could see the impact on her in many ways that took decades to diagnose. And that's often the case with neuropathy. Long time to figure out what is causing this. She had cough for a couple of decades before anything else began. And that was really related to vocal cord incoordination. Then there's the sensory changes that happen, and the sensory pain being the worst of it. But when people have sensory dysfunction and they can't feel where their feet are, there's a lot that you lose. You lose your balance. You have to go slowly. I had to convince her to give up her driver's license. One of the hardest things to do for people is give up their driver's license. But if you can't feel your feet, and your hands are also numb, so you can't really move to hand controls, then you can't safely operate a motor vehicle. So that's a very hard thing. And the pain wasn't a big part early, but became more and more and more of an issue, where the pain was excruciating and uncontrollable unless she chose to be sedated and not really be able to function. So I witnessed all these, not just from people telling me their stories, but from seeing them. And I know this is a really critical issue. There's another area of neuropathy that is often not talked about much, and that is autonomic neuropathy. And that was a major part of really what did my mother in, and that was that the nerves also control your bladder, your bowels, your heart rate. And when you lose function of these critical things, your life becomes circled around managing your bladder and your bowels. And when your heart rate control is gone, just simply sitting up comes with tremendous fatigue. So these are things that are often unrecognized. They're not part of everyone's neuropathy. Different neuropathies target different nerves. She didn't have any weakness. She had no motor neuropathy as part of this. And so I think recognizing the different patterns and the different things that neuropathy can do to people is very important. And so your association and a focus on education and advocacy, bringing this issue to light, is just critical, and you need to be commended for that. And I hope all of you will help by building the society, by even telling your story, because everyone's story is unique, can add to the education that the public can have. So I'm not going to continue talking more. That's why I'm here and why I want to congratulate all of you. But I really want to congratulate your leaders for making this day happen and making the whole association happen and be there. Thank you.